Today's goal is honestly just to make technology work. If we can just get the tech to work, I think most things will work out. Hey friends, it's your good friend Tim Campbell-Smith, and today we are talking about why mental health is important. This is still a conversation that is happening, and I think it's going to be happening for a long time, and it's a question that's still getting asked. I think this video and this discussion is more for people who either don't think it's important, which is okay, and we'll talk about why that still happens, and I think it's also for people who maybe don't understand the connection between mental health and our everyday lives, and not just our own everyday lives, but the everyday lives of people around us. Mental health starts by affecting us on a personal level, it then moves to a social level, and then to a communal level, and we're going to talk about all of that. But mental health definitely permeates every part of our existence. And that's what we're going to unpack today. Before we go too far, make sure you like and subscribe for all things mental health, photography, career, life. So I think I would say that my thesis or my point for today is that mental health affects us on an individual level first, but it doesn't stop there. That's a very Western view. It then affects us on a social level, so it affects how we navigate and interact with the people around us, because remember, humans are pack animals. And then it affects us on a communal level, affecting even more people around us, but then also the people who come after us. More on that, what that means later. I think we still have to have this conversation because as a society, we are still not as familiar with the altered function of the brain and how alterations in the brain can, and in our DNA and in our biology, which we'll talk about, how that can really affect us and affect other people. It's only been in the last 50 to 60 years, and that might even be a little generous, that we've actually started to embrace mental health, the concept of mental health, and working on improving mental health. So to make this all make sense, I'm going to work off of a concept that we are all familiar with and happens to every single human, and that's the concept of getting sick. More specifically, getting sick in one of our body parts. So the two comparisons I'm going to make today that are, I think, the easiest are one, getting a virus that maybe causes a cough in our lungs, so we're coughing, and two, spraining a body part, and most notably, I'm going to use a wrist, just because it's easiest to reference. So if we use this, what we call the disease model, which is the concept of like structure, function, disease, remedy. If we look at if we look at the disease model, we have organs and they have functions. So in the example of getting a cough, what's affected is your lungs. One of the big uses of lungs, why they exist, is to exchange oxygen from the environment to go throughout our bodies and that we use, and to get rid of carbon dioxide. Can also help get rid of toxins. Likewise, a wrist is a connection of bones and tendons and veins that connect our arm to our hand, and then also give it range of motion, flexibility, and function from there, right? Just like your brain controls different things, we can break down what the brain does into kind of two categories. Things that are automatic that we don't think about, and things that we are maybe a little more conscious of. So there's automatic functions, like your heart rate. You don't have to consciously think about beating your heart, pumping blood, right? It also controls like your breathing, that kind of thing. But then there's things you are consciously aware of, like some of your thoughts, like your beliefs, like your behaviors. These are in your brain. So just like our other organs and our other body parts can become unwell and affect their function, so too can our brain. When your lungs are affected by maybe a virus, or heck, even think like if you're breathing in a lot of smoke, if there's like a fire around or there's pollution in the environment, it causes you to cough. It alters your function. Likewise, if you fall down and you catch yourself with your hands, it's going to put a lot of pressure and affect your wrists, right? And that could alter their function and then how they function afterwards. The same thing can happen to your brain. So just like your brain can be altered, that also means that things can happen to your brain that maybe impede or change function. That's where mental health comes in. That's how mental health shows up in our lives, by having an altered brain function. Then we have to ask, okay, then how does mental health affect us? And it's, individual level, social level, and communal level. And let's start on an individual level. Let's talk about mental health effects on an individual an individual's life. First, I would say, and in no particular order, mental health affects what you do and what you don't do in the world. It explains why we go after some of the things we do, ambitions, goals, everyday behaviors, but also things that we avoid. So, for example, if you're nervous of being around people, maybe something happened in your life where you're scared of people make you nervous. Heck, not even that. You could just be introverted, which isn't a bad thing, isn't an altered state of being, but that part of you means, will result in something. It will means you're less likely to go outside, you're less likely to interact with people, and humans are pack animals. We're meant to be in relationships. So, where do relationships pop up in life? They pop up in work, in intimate relationships with partners, with friends, that then affect social activities. So that's one way that mental health could affect you, is how you navigate the world. It may also affect how you perceive the world. If you're defensive, if you're nervous, if you're untrusting, because harm has been done to you by no fault of your own. Usually when harm is done to you, if you're less trusting, you may have more negative thoughts, more negative beliefs, which leads to harder emotions to work through. And that can affect you as well. It could affect your work, mainly when you work and how you work. Mental health could also affect your quality of life, including your physical health. So this is your overall, if you had to describe your life, would you give it maybe a more positive attribution or maybe a more negative one? This also, though, affects, and part of quality of life is your physical health. Mental health has deep connections to physical health. Because remember, we have different types of health. We have, for example, mental health, behavioral health, physical health, spiritual health. Mental health can affect our physical health. One emerging area of research, and I know this affected me and was fascinating, was something called the brain-gut axis. Researchers are every day more and more discovering how the brain actually has different neural pathways that connect to our stomachs. I remember when I was first diagnosed with IBS, irritable bowel syndrome. And mind you, this was a long time ago, over 10 years ago. My doctor, I remember her explaining, we're not totally sure what it is, but we think there's a mental health component, so if you can try and manage your stress. And it turns out, I get an upset stomach when I'm either way too excited or I'm way too nervous. We have since come to learn that that's because of the brain-gut axis, and that mental health has a very physical component as well. Mental health will also affect your social health, because remember, on a cellular level, humans are meant to be pack animals. We're meant to be together. So, and this is why we have communities, this is why we have families, this is why we have friends, why we have groups. But mental health, and usually mental health concerns, cause us to retreat inwards, causes us to retreat away from people, right? And that can lead to a lot of other problems. Isolation, ostracization, I think I've got that right, which researchers have found when we feel ostracized, that affects other parts of the brain, also affects our physical health as well. So see how it connects and comes back that way. It's interesting because our mental health affecting our social health, we need a social life. We need to be socially connected, and those social connections feed back to us. So when we cut off a social life and being social with others, we cut off that feedback loop that sustains us and is a part of us. And that nicely transitions into mental health affects immediate social circles, so the people immediately around us. There's this interesting phenomenon I learned about in a psychology course once, how people with mental health concerns don't always make good company. And so they don't always get invited out to things as often. And their social circles shrink. But the one thing they actually need more than a lot of other things are social connections. So we have to be mindful of that and see how that can affect our mental health, and then can feedback loop and affect our mental health in other ways. And again, just like pack animals, nobody should be left behind. But mental health causes a lot of people to get left behind. Mental health, especially in socially, can also affect opportunities and missed opportunities. Think for job advancement, for actually anything that could happen in life. And it can also, an individual's mental health on a social level can also affect group dynamics. It can change group dynamics. Think about like, and if you've ever had a group of friends and there was like one negative person who brought the whole group down, or the opposite, if you had like one really positive person and they just kind of raised maybe morale or spirits or affect of a group. An individual and their mental health can change group dynamics. Another interesting space where this happens, and there's growing interest in, is how teachers' mental health affects children. Normally, we look at how children's mental health as groups affect teachers, but now we're starting to look at people in positions of power and how it affects a group, like say in a classroom, in a teacher setting. So one person's mental health can change group dynamics. And then the final area, mental health can have a huge communal effect. And communal here, I mean larger groups of people, more than just our immediate social circles, and anybody who comes after us. And I'm really actually referring to birth and families. So a really easy example here to draw is think about like if you harm a young person, or when you hear of a young person, and I'm really referring to children, unfortunately in this case, when a child gets harmed, when a young person gets harmed, think about the harm that causes to them, which is valid and sacred on its own. But then if they go on to harm others immediately around them, their peers, other kids, and then think about like when they grow up, how will they affect others in the workplace, in other schools, and if they have kids. And speaking of having kids, this is something I'm learning about right now, and it's fascinating. Epigenetics. Think about harm to not only children, but to ourselves and how we can pass it on to kids. One area of science that's getting applied in psychology is epigenetics, which is when changes happen that can't be always attributed to or seen in our DNA, but does get passed on to others. There's a growing body of research that this explains intergenerational trauma. That when we, as adults, experience trauma and harm, when we go to reproduce, either through sperm or through eggs, we are passing on our psychological experiences, and actually down 2 generations. Like you're always affected by 2 generations in any direction. In terms of mental health, and that's epigenetics. So remember that as well. It's also kind of getting into your biology. It's getting into your kind of into your DNA, but not, and getting passed down. That makes it very communal. Communally, mental health can also have economic impacts. Now, I want to make an important note here. We are not internalizing capitalism on this channel. Internalized capitalism is where we consciously or unconsciously adopt the beliefs of capitalism, that everything should make money, making money comes above all other priorities, and everything is about free market, businesses running the world. No. But there is economic impacts, and that it may be something worth thinking about. And in the spirit of considering all perspectives, that's why we're talking about the economic impact of mental health. You have a person or a group who is affected by mental health. They may be coming to work less. That may affect, if you look at just a company, if less people are coming to work, that's affecting customers. Customers affect business, right? As we previously discussed about how mental health can affect how we perceive the world, it also impacts how we perceive maybe the economy, and then that changes our behavior. So it has some economic impact as well. Overall, it's important to see how interconnected all of these things are. Mental health truly affects all of us on an individual level, a social level, the people immediately around us, and a communal level. Large groups of people, especially those who may come after us. The sheer gravity of what mental health affects and how it affects it is what makes mental health important. So when people ask, why is mental health important? It's important because it affects every part of everyone's life. Just like having a body physically existing has an effect on ourselves and has effects on other people, so too does mental health. Ultimately, it does come down to your experience and how you interact with others. Are you living a happy, healthy life? If not, what's stopping you? Or what would it take to change that? But those are for other videos and, frankly, qualified professionals. Comment and let me know, how would you tackle the question, why is mental health important? Why do you think mental health is important? Or what other questions do you have? As always, make sure to like and subscribe for all things photography, mental health, career, and life. Otherwise, we'll chat soon. Bye for now.